Okay, tell me when you start.
Oh, no.
Okay, today I'm going to be giving a speech on physician-assisted suicide. A very popular debate is whether physicians should help with the end-of-life treatment. Should physicians be able to help end the life of a patient upon their request? A recent study of practicing physicians showed that 57% received a request to assist with the end-of-life treatment upon their wishes of the patient. Physicians must respect the wishes of patients when they decide to quit all treatment to help with longevity of life. Physician-assisted death is not something new. This has been going on for decades now, since the beginning of medicine. Even though it is a very popular debate, physician-assisted suicide should make sure that all best end-of-life treatment and care has been practiced. What is physician-assisted suicide? Physician-assisted suicide, also abbreviated as PAS, is prescriptive medicine such as morphine or potassium to intentionally end a person's life. There are certain criteria that must be met. First, the patient must have a disease that is incurable and causing severe suffering. The doctor must explain to the patient, and they must understand their condition and prognosis and have a second opinion. He or she must be aware of all reasonable palliative measures. If a patient is suffering from depression, a psychiatric evaluation must be met before they will sign off to allow this procedure to be done with the patient. These steps and procedures must be met before the procedure is performed. Now that we have established the protocols and what physician-assisted suicide means, I will now talk about which of the states it is legalized in. There are only a few states in the United States that have legalized the physician-assisted suicide. Oregon, Vermont, and Washington have legalized this. The Death with Dignity Act was established in Oregon on October 27, 1997. According to the New York Times, July 31st, 2013 issue, Vermont was the fourth state to legalize physician-assisted death. In 2012, Oregon had 115 patients. That data was taken that also showed that physician-assisted suicide was typically done by white, educated men. 20 to 30 states have introduced to legislation but has never passed. The Netherlands is a little different. They have been doing this for 30 years now. However, the U.S. does not recognize legalized suicide, but Switzerland is a little different. Where can you go to have this actually done? In Switzerland, there is a place called Dignitas. This is actually a room there that you can see. This is where the patient would go. And they have a resort there where the family member and friends can also spend the last few days of their life enjoying their time with their loved ones before they pass. Also, the U.S. Does not legalize this, and the Netherlands does. They say that over 1,000 people, or more than 1,000 people, travel there for assistance. Not only do citizens think physician-assisted death may be wrong, but also thinks that it violates a physician's role as a healer. Although they think that physicians can heal patients, and even if they have cancer, they feel like they can still treat the patient. But some patients do not want any further treatment once they start suffering. Though assisted suicide is a controversial issue, it is one that is necessary to discuss. Also, while the patient is there to have the treatment done in Switzerland in the room, what happens is the patient would come in, and while they are there, they will get a drink whenever the time is ready for them to pass, and they have said all their goodbyes to their loved ones. They get a tea that they sip on to drink. They are then assisted by the staff there, and they give them the tea that usually works within about 3 minutes. Once they are given the tea and they sit there, they say that the patient goes into almost like they're having anesthesia, and they have a woozy feeling. Once they have that feeling, they are lying down, and they typically just go on and pass. They then get the stethoscope and also take their lung sounds and make for sure that there are no more breath sounds or anything. That has also given the family members time to discuss any issues that they might have had and to give them their last final words. There is critical debate with physician-assisted death and laws. Terminally ill patients should not have to suffer and should have the right to choose how they end it. The question whether severely ill patients are entitled to help is still being debated. There are several pros and cons to this. Some say that there are many more pros than cons, just depending on how they look at it. Once it has gone through legislation and they actually go down to vote, they say it's typically 50-50, even though they say that more people are against it. It's typically 50-50 once they go to pass it through legislation. Giving patient and doctors more open access to last resort options, it would be ethical to offer physician-assisted death when all palliative resorts have been taken without relief.
Very good.